Hi Facebook family. I wanted to do a post today on menopause. I know a lot of people heard about it and probably don't really know what it is, I imagine, or what it feels like. So I want to discuss the symptoms of menopause. So let's start with first what the definition of menopause is. Menopause is 12 consecutive months without a menstrual cycle. And the normal age for women is actually 35 to 55. And some women can start experiencing symptoms of menopause 5, 10, and even 15 years before menopause, which we call perimenopause. So a woman will actually spend half of her life without a menstrual cycle. Well, why is this important? Because the symptoms of menopause can be, very debilitating. It can affect quality of life. So let's go over some of those symptoms. So the most common, or I don't even say most common actually, let's say the most well-known symptom of menopause are hot flashes. Well, actually, many women never get hot flashes. Now, don't get me wrong. I know that they're real and that it is very much so could be somebody's state of menopause, but not every woman that's in menopause will have hot flashes. But hot flashes is a symptom of menopause. Night sweats is also a symptom of menopause. And I have a lot of clients, they describe it to me. They said, hey, it's like I'm soaking through my sheets. I got to get up and change the sheets, but when you start sweating, then you turn on the fan and you get cold because you're so wet, and you're changing the sheets, and then your spouse is getting affected. So yeah, hot flashes and night sweats can really affect the quality of life. Some more symptoms of menopause is vaginal dryness, and that's just a sign of not a sufficient amount of estrogen, but specifically, so a certain estrogen will affect temperature, and another type of estrogen will affect the vaginal tissues. A woman's body naturally makes 3 different types of estrogen. So more symptoms of menopause: anxiety, mood swings, irritability, depression. Like all of those mood symptoms, I feel like are such a big miss when it comes to menopause, because it's just so assumed, oh, well, you're depressed, so take an antidepressant, when it's like, hey, that's not the reason why somebody has depression. It's not because there's a lack of antidepressant medication in their body. It's because that there's an imbalance that's causing it, and we just need to fix the imbalance so they don't need antidepressants. I can tell you a majority of women that are on antidepressants, because they're in menopause, once you get their hormones balanced, then they won't need those antidepressant medications. Oh, and I see a comment. Yes, please come and see me, because I love to help. I love to help people, but specifically women with hormonal imbalances is where my heart is. So yes, please come to see me. I'd love to help. And so more symptoms of menopause: insomnia. Now I can tell you, I feel that, oh man, let's say like 95% of my clients who are in menopause have difficulty falling asleep and staying asleep. And it's a sign of basically their progesterone is lower, which is also why they have the mood symptoms like the anxiety, mood swings, irritability, depression. And so I love to compound for them oral progesterone and put it in a sustained release capsule so that I can help them to fall asleep. And then since it's sustained release, it'll keep releasing in their body over 8 to 12 hour period, and I help them to stay asleep. Oh, I love oral progesterone for women for that reason of sleep alone. So more symptoms of menopause: loss of sexual interest. And that's due to a variety of hormones, because obviously if you're anxious or depressed, you're not going to be feeling like being intimate. But of course, testosterone, if that's low, if you're having hot flashes and night sweats, you're not going to be feeling in the mood as well. So there's numerous hormones that will affect loss of sexual interest. Hair growth on face. Yeah, we don't like that, but that can be a symptom of menopause. Painful intercourse. That can also happen, and there's multiple reasons why that could be. One of the reasons we see most common is vaginal dryness, because that will not be pleasant. When there's dry and it's dry and friction, and then having intercourse. So yeah, painful intercourse is a symptom of menopause. Pain attacks, not panic attacks. I'm not misspeaking. Like pain, like oh man, women will describe it like achiness, like arthritis-like symptoms. Really, is what it feels like. Achiness in the joints, in their hands, in their knees, in their ankles. So pain is also a symptom of, or pain attack is a symptom of menopause. weird dreams. I know when one of my hormone seminars, a woman said, "Oh my goodness, I'm so glad that you said that because she'd been having some really unusual dreams." And so that can be a symptom of menopause. Urinary tract infections. Again, because of the hormonal imbalance now, we don't have a favorable pH in our vaginas. And so then we're more prone to unwanted bugs and bacteria and yeast. So urinary tract infection, symptom of menopause. Vaginal itching, we see that in menopause. Lower back pain, going back to the pain, that just comes in with menopause. And I feel like this is another big miss in menopause because it's just assumed like, oh, you're getting older, so you're just going to be in pain, and that's normal. No, it's not normal. It's not normal to be in pain and uncomfortable, and we just need to fix those imbalances so you don't be in pain. Bloating. Oh yes, bloating is a symptom of menopause, and we see that because there's, women may start to retain fluid, usually because again that progesterone is lower. Progesterone is a natural diuretic, so again, instead of taking a prescription medication, that will help you to, get off excess fluid. We can just fix the issue of why you're retaining fluid and why you're bloating, and that's usually because of lower progesterone. We can replace the progesterone. So, flatulence. Ugh, yes, ladies, gas can be a symptom of menopause. And the reason being why there's so many symptoms when it comes to menopause is because there are hormone receptors all over our body. It's not just in the uterus that there's a receptor for a hormone. I mean, it's hormone receptors from our head to our toes. Like literally in our eyes, we have hormone receptors. In the colon, we have hormone receptors. I can tell you actually 20% of thyroid hormone is made in the gut. So it's just crazy, how many areas of our body are affected by hormones. So yes, so flatulence, gas, bloating, indigestion, we see all that in menopause. And I've had some clients, once we replace those hormones, and then they come back and they're like, my bowels are moving quite regularly now. I'm like 2 to 3 a day. I said, perfect. That's where we should be at anyways. So we do see better bowel function when we even have hormones replaced as well. And so bone loss, also another symptom of menopause. And there's a connection with this, specifically as it relates to connection between hormones and bone loss because of estrogen. So estrogen helps your body to utilize magnesium. Well, why is magnesium so important? Because magnesium helps to put calcium in the right place in the body. When we talk about bone health, there's about 18 different factors you have to consider. It's not just take calcium. You need to make sure you have magnesium, and anytime you're supplementing with calcium, so that you make sure the calcium gets to the right place in the bone. So if you're low in estrogen, then you're not utilizing magnesium, and that will affect bone health because magnesium is so important in putting calcium in the right place so that you can have healthy bones. Hair loss. Another thing that we see in menopause. Now, hair loss does have multiple factors, about 7 different factors you have to consider. Like 3 or 4 of them involve hormones. so yes, hair loss hormones have a big impact on hair loss. As in menopause, the hormone levels are low. Sometimes all of them, the estrogens, the DHEA, progesterone is low. Sometimes testosterone can elevate, but we'll discuss that in another video. So yes, hair loss can be a symptom of menopause. Frequent urination can be a symptom of menopause. So the bladder is just becoming weaker. And then also too, some incontinence we'll see. So incontinence, like if you're, when you laugh or cough or sneeze, there's a trickle. And I've learned with my clients that some women just equate that with normal. Like, oh yeah, girl, I just have a trickle. And I say, no, ma'am, no, we're not supposed to trickle. Trickle bad. It could be a sign of a weak pelvic floor, but also too, there's some bladder issues. And the bladder has to have a perfect balance of estrogen and progesterone, those 2 hormones. So when there's an imbalance, then we may see incontinence and we may have leakage. And so when we talk about incontinence and frequent urination, there could be multiple factors, a weak pelvic floor, but also hormonal imbalance could be a reason. And so we can tackle both of those at the same time to help resolve that symptom. Snoring. Yeah, snoring can be a symptom of menopause. And I know some of my clients' husbands are like, please just fix it. I can't sleep. So yeah, snoring can be a symptom as well. Sore breast can be a symptom of menopause. And also heart palpitations. Now this one is super interesting as it relates to heart, because a lot of times there's even one of the a well-known hormone specialist that I study under. She talks about, she used to be an ER doctor. That was her first, introduction into medicine. So many women in menopause would present to the ER with heart palpitations. So they do all the heart scans, trying to make sure the heart's okay, and they're fine. And she said, oh my gosh, she said, I wish I would have known then what I know now, because heart palpitations can be a symptom of menopause. And I see it in my private consultations. I have sometimes women, when those heart palpitations start, they're like, oh, wait a minute. And we just pause. And we wait for the heart to calm down. And then, and then we can resume. But once we start to balance their hormones, the heart palpitations go away. So yes, heart palpitations is real, and it can be a symptom of menopause. Varicose veins is also a symptom of menopause. I know people are like, oh my gosh, she's still going, but I just want to list them all out to you, because a lot of times these symptoms can be associated, but actually it's like you just go into, if you go into a traditional doctor and they're like, oh, well, you've got incontinence, and they put you on a prescription drug, or you've got, you can't sleep, so they put you on a sleep aid. And so instead of getting all of these prescription drugs, we can just fix the imbalance that's causing the symptoms. Oh, yeah, I have a question here. So are you a doctor? Yes, I'm a doctor of pharmacy. So that's my specialty area, is a doctor of pharmacy. And then I have a special focus on hormonal imbalances. So yes, great question. Feel free to ask questions as I go, because I have more symptoms to share. Oh, and what's my next one? Oh, dizzy spells. Another symptom of menopause, and I do see that actually a lot. Dizzy spells, panic attacks. Oh man, the anxiety that you can see develop in menopause is so, it can be overwhelming. Like literally sometimes I have, clients when they're in my office and we're talking, they're just like, I have no reason to be anxious. Like, there's nothing going on in my life that should have me on edge, but they're just like, they're so anxious. They're like literally on the edge of their seat, kind of like leaning in on my desk. And so that the panic attacks or anxiety can be very severe and really frustrating for, a person when you don't have anything going on in your family or in your job, but you just have this unsettling feeling. That is a symptom of menopause. Skin feeling like it's crawling. Oh yeah, when I say that in my hormone seminars, some women are like, oh my gosh, because it's like they can't understand it. They're going to dermatologists, they're using all these creams and steroid creams. They can't solve the issue of why they're itching. So yeah, it can be a symptom of menopause. Migraine headaches, we see that, and specifically you may see headaches as it relates to that progesterone hormone again. When it's lower, some people may get headaches. Memory lapses. Yes, this one, usually when I say this one, that's when I see the tears start falling when I'm counseling women, because some women will say, oh my gosh, I thought I had early onset Alzheimer's. Like, my memory is gone. Like, I've lost the ability to spell. I keep losing my keys. They say it's like the tip of the tongue phenomenon. Like, you know what you want to say, but it's not coming out right. And so it can be very frustrating, especially I've had women that, if they're trying to learn something new on their job. I've had some women say, oh my gosh, I think I'm going to lose my job because they're training me and I can't retain any new information. Or, you meet somebody and, well, you think you're meeting them, but you've already met them before. I have clients that had that happen, or like literally like fights between spouses because the husband's saying, babe, I told you this already. Like, don't you care enough to remember? And she's not trying to hurt her feelings. She literally just can't remember. The reason is why this memory, you have memory lapses in menopause, is because estrogen for a woman is like her memory. So when her estrogen is low, it affects her memory. And literally estrogen, specifically estradiol, works on an enzyme that helps to prevent Alzheimer's. So there is a huge link between estrogen and memory in a woman. And so I like to give women that assurance that no, it's not onset Alzheimer's. You're just low in estrogen, and we can fix that and we can replace that. Oh, and weight gain. Weight gain in menopause. On average, a woman in menopause will gain about 20 pounds. So, again, I feel like this is another symptom that's just like, oh, it's just normal. You get older, you gain weight. No, you don't. And it's a sign of hormonal imbalance. Weight loss is all about hormones. It's not about low calories, it's not about exercise. It's about balancing the hormones. And when the hormones are balanced, we can lose weight and keep weight off. So weight gain, yeah, another symptom of menopause. Oh, and there's more symptoms. When I do my when I do my hormone seminars, it's usually about 2.5 hours because there's so many things things to discuss as it relates to hormones. Oh wait, okay, yes, I think that's my last page. But one of the things that I've heard in my consultation that really described menopause well for me was when I had somebody tell me, it feels like I've had two lives. I had a life before menopause, and then I have had a life after menopause. And specifically for women who have had a hysterectomy, they're put into a sudden menopause. You know, it's not gradual. It's not a gradual decline of hormone levels, but it's just suddenly now. We've taken out the uterus, which for a woman, the uterus is like the engine of a car. And so it's so abrupt, and they feel that, and it affects so many areas of their life. And so definitely, you know, if you're in menopause, you know somebody that's in menopause, anyone that's perimenopausal will start having, people will start having these symptoms too. Please send them my way because I want to help. And not a lot of traditional practitioners, traditional doctors understand hormones and how to replace the hormones properly and safely. And so I do bioidentical hormone replacement therapy that I can help women so that they don't have to suffer. And there's so many things out there that say, oh, hormones cause cancer. And it's like, no, hormones don't cause cancer. When a woman is pregnant, she has high levels of hormones circulating in her body, and she doesn't have cancer. She's not full of blood clots, but she's able to sustain her life and to produce another life. So that's just a simple way to show that hormones do not cause cancer, but they should be only given by somebody who understands hormones and their effect in their body. So, somebody like me, a hormone specialist, can help with that. So, oh, I see you said that is me. So, yes, that is me. Please contact me. I'm actually here at work now, so feel free. You want to call or email me. The phone number here is 918-505-9650. You can actually text message that number too. Email me at pharmacist@bethelpharmacy.com. You can message through the website at bethelpharmacy.com. You can Facebook message directly, and I'll get that message or comment on our videos. But my goal really is just to empower women so that they have the information that they need to be healthy and not suffer and not be on a bunch of prescription drugs that they don't need when we can just fix their hormones. So yeah, that's my message for today. Those are the symptoms of menopause, and thanks for tuning in. Until next time, bye.